Good evening, and thank you for joining this Lutronic virtual workshop, featuring Dr. Steve Weiner, MD, as he presents Keralase, a breakthrough treatment for hair and scalp health. The webinar will last for approximately 35 minutes with a 15 to 20 minute question and answer session at the end. Please feel free to send questions during the webinar by using the chat option. Your questions will not be viewable by other attendees and will be addressed at the end of the presentation. All participants will be in listen-only mode during this educational session. Additionally, this event is being recorded for your future reference and will be posted on the Lutronic website. Once again, today's webinar is being presented by Dr. Weiner. Dr. Weiner is a board-certified head, neck, and facial plastic surgeon. After graduating from UCLA, he completed medical school at the University of Michigan. He interned and spent his residency at Johns Hopkins Hospital. Dr. Weiner established a private practice in Thomasville, Georgia with great success for 10 years, before envisioning the future of cosmetic procedures as non-surgical. In 2005, he laid down his scalpel and began concentrating all of his efforts in non-invasive and minimally invasive cosmetic procedures, and he created the Aesthetic Clinique. He brings extensive experience to the clinique. He's used Botox for over 20 years and several different lasers over the past 25 years. His surgical experience includes all the common facial cosmetic procedures. In addition, he has performed extensive surgeries on the head and neck for cancers, tumors, and trauma. Dr. Weiner's hobbies include soccer, bocce, running, snowboarding, and stand-up paddleboarding, and poker. Ladies and gentlemen, without further ado, I'd like to please turn it over to Dr. Weiner. Enjoy tonight's session, and we'll talk to you on the other side. Thanks.
Hello, this is Dr. Weiner, and I'm speaking about Keralase today, which is a great new procedure that improves revenue and improves hair. And I'm going to go through it. It's a very easy procedure, very delegatable, and we're having a lot of happy patients with this. So it's an exciting new revenue stream between Lutronic and Skin QRI. So the hair loss market is huge in the US. 43 million women and 63 million men. So that's almost a third of the population has problems with their hair. And you're going to find that a lot of people are coming in because of that. So some stats. By the age of 35, 66% of men will experience some degree of hair loss. And by 50, 85% of men have significant thinning of their hair. 25% of men who suffer with male pattern baldness begin before they reach the age of 21. But don't forget women, because women actually make up 40% of the hair loss in America. And don't forget about the social and emotional impact that hair loss has on people. And there's a couple studies that are quoted here. Alopecia causes serious psychosocial consequences, causing intense emotional suffering and personal and social work-related problems in around 40% of women. And 40% of women have marital problems, and 63% claim to have career problems related to their hair loss. That was a study done by Understanding Alopecia by Drs. Hunt and McHale. So alopecia also causes a lot of depression, anxiety, and social phobia in a number of sufferers. There is a relationship between alopecia and psychosocial consequences, and it's very complicated. And it can result from stressful experience and then lead to future distress. These were by the same authors as well. So hair is essential for the identity of many women. Femininity, sexuality, attractiveness, and personality are symbolically linked to women's hair, much more so than for the man. So treating hair loss in the US is a $1.74 billion industry. And there's a lot of prescriptions currently on the market. There's oral finasteride or Propecia, and there's topicals as well, calling minoxidil, Rogaine, and there's also orals like Nutrafol. But now there's a new product on the market called Kerafactor. And Kerafactor is available in shampoos. And we're going to talk about the in-office treatment using Kerafactor. So more aggressive treatments are using hair transplants, conditioned cell media, PRP, which is a huge market in the US already for hair, and it's 300 million. But there's significant pain with these injections, and often you require injections with lidocaine and or Pronox to get through these procedures. And obviously you need topical as well. The results are somewhat variable, and that's probably related to a recent study that suggested that all PRP is not the same, and in fact, PRP from people that have taken nonsteroidal anti-inflammatories is much less efficacious than people that haven't taken nonsteroidals. And what we don't know is what other factors can also lead to less PRP effectiveness. So everyone's PRP is going to be different. The concentrations are going to be different. And so there's a lot of variability as well between person to person in the efficacy of their PRP. But with Keralase treatment, you know exactly what you're getting in each patient. So just as a side note, the year-over-year growth for hair procedures is 24%. And I've read that the growth in our industry, the aesthetic industry, is between 10 and 12%. So it's approximately double the industry growth rate, which is very interesting. And that's what I see in my office as well. So here's the new treatment, Keralase. It uses LaseMD, which creates microchannels in the scalp. And these microchannels aid the absorption of compounds. And that's been proven time in and time out. Ever since the LaseMD was introduced, it's been noted to improve absorption of compounds. In fact, in Korea, that's its mainstay of treatment for the LaseMD is for expediting compound absorption. But in the US, obviously, we've used the LaseMD for resurfacing as well. So the Kerafactor serum has a proprietary biomimetic synthetic version of growth factors and proteins. It's a multifaceted topical formulation. So there's 4 international studies regarding scalp revitalization using just the LaseMD alone. The LaseMD has been proven to increase the absorption of nanoliposomes by 5 times, and that's a graph on the right there. The picture on the left, the histology, is what a LaseMD coagulation zone appears like. And then the middle picture shows the microchannels created by the LaseMD in an electromicrograph. So Kerafactor products are in-office therapy, and there's also a take-home solution. They're proprietary and patent pending. So what is Kerafactor? So a specific selection of concentration of each of the 5 biomimetic growth factors and 2 skin proteins for scalp revitalization. Their proprietary formulation derived by studying scalp growth factors deficiency during hair loss and poor scalp health. Each of these growth factors and skin proteins is individually wrapped in a nanoliposome carrier for enhanced absorption. That's very important. And I'm going to show you why that's important in the next slide. What also is important, it doesn't contain any of the drugs. And there's a lot of patients who are opposed to these drugs, particularly finasteride, because there's sexual dysfunction associated with that. So there's no hormones and no drugs in Kerafactor. So the nanoliposomes, what the nanoliposomes do is they wrap each of these growth factors, and they allow better penetration into the hair follicle and into the stem cell area of the hair. And so this graph picture on the left shows without any nanoliposomes, the penetration. You see the green fluorescence. There's not much penetration without the nanoliposomes. And then with the nanoliposomes, you see significant improvement in the penetration down the hair follicle shaft. How does Kerafactor compare with PRP, which is probably the gold standard up to this point for non-invasive hair growth? So Platelet-rich plasma contains variable contents. As I told you, every patient is going to be different, as well as what's going to affect them. There's going to be medication interactions. So you're going to get variable results. So in Keralase, you have a consistent hundreds of microchannels followed by consistent customized formulation for hair revitalization. So you're going to get the same concentration of these very important growth factors in every patient. So what are the advantages of Keralase over PRP? So PRP, you use your own growth factors, that's advantageous. And some people do see improvement, but not all of them do. What are the cons? It's very time consuming to draw the blood. You know, sometimes you have a hard stick and it takes several sticks, and that's not very pleasant to the patient. And that's painful in and of itself. Then you'd start to inject them into their scalp, and that's quite painful because most often the PRP is mixed with citrate, and citrate is acidic, and that causes some burning. Even if you numb them up, the numbing process, the ring block, is quite painful as well. I often have to use Pronox for this. So there's going to be huge variability in results. If they're deficient in one growth factor, you know, small increases will be ineffective. But in high doses, TGF-B1 is known to be inhibitory of the anagen phase of hair growth. That's very important because that's the limiting factor. If you want to get really high doses of PRP, you're also going to get higher doses of the TGF-B1, and that's going to be counterproductive. You're also exposing the staph to bloodborne pathogens, and there's expensive disposables. In my case, the disposable cost is $300, and I use a high-grade PRP system. It can only be injected, and how much and how far apart. So there's a human element of variability that can't be accounted for. Overall, it's a poor patient experience, and patients don't like to be injected. Now comes Keralase, which is a short procedure. It's 10 minutes. And I will gander to say that my procedures are not 10 minutes. They're much less than 10 minutes. They're between 5 and 8 minutes. It's very tolerable, no painful injections. No topicals are required. Okay, this is in and out in less than 10 minutes. They're specifically tailored for scalp and hair rejuvenation and revitalization. So it eliminates the inhibitory factors. Only the good growth factors are placed in Kerafactor. It has lasting hair and scalp health, significant reduced variability of technique because it's very reproducible procedure. And it's a completely new revenue stream. Let me point out that the LaserMD Ultra has many more procedures that can be done with it other than the Keralase. And so there's a lot more revenue stream for the laser than just this. I use it for melasma. I use it for resurfacing, for pigmentation, for precancerous lesions. It's a great laser with very little downtime and extremely low risk. So the simple protocol is you treat the scalp with the Ultra, and that creates the microchannels. Then you massage in the Kerafactor serum. And then you get one treatment every 2 weeks for 6 treatments. I do recommend taking home a home product as well to use between office visits. And keep in mind, no numbing cream is necessary. This procedure is a 1 or 2, maybe even 0 for some patients out of 10. Okay, 13 weeks out after the standard 6 treatments, much improvement noted in the front here. You can see at 4.5 months out, significant improvements. He had 1 treatment every 2 weeks for 6 treatments. Okay, again, 13 weeks out, 1 every 2 weeks for 6 weeks, and you see the improvement. When my patients are seen after their 3rd treatment, they're beginning to see the results of treatment, and that's consistent with all my patients. So what this is trying to show you is that there is improvement. And you see there's a little tattoo in the upper left. And so this is the exact same area on the patient. And what you're seeing is the significant improvement in numbers of hairs after 13 weeks. And the 1 means that there's 1 hair out of the follicle, and a 2 means that there's 2 hairs out of the follicle. And you can see that there's significantly more of these 2 versus the left side in the after as well. What this is going to show you is the improvement in the diameter of the hair. So what happens as hairs get older and you start to lose hair? Well, prior to losing your hair, the hairs get smaller and smaller. They get miniaturized. And that's a sign that the hair is getting less and less vascular supply. So what does this do? This improves the vascular supply because the MD Ultra, as well as the care factor. And so improvement in the hair diameter is a significant indicator of hair health and scalp health. So this is just another one of the similar type of improvement where you see a lot more 2s versus the left side, and you see a lot more 1s as well. That's 13 weeks out. Here's another one measuring the diameter of the hair. And these little small circles show that these hairs are ready to come up. If you look at them, they're little black dots, and they're the hairs that are ready to come up, almost like a seedling, ready to pierce through the soil. So those are going to be hairs that you're going to see in the near future. So this is showing you hair improvements after 13 weeks. This is repeatable and consistent. That's the one thing I want to stress, is that this doesn't rely on human errors that could occur and the unreliability of the PRP. So I've been doing PRP for 5-6 years or so, and I switched all my hair patients to the Keralase procedure. So at 6 months out, the hair continues to show improvements. So again, the big black dot in the middle is a tattoo, and what we're showing is the tattoo is the big, or the smaller dot in the middle of the right side, and you see a lot more of the 1s and a lot more of the 2s. So 12 weeks, 13 weeks. What we're just trying to show you is consistent, repeatable results. And again, the hair thickness is larger when you measure the diameter of the hairs. So when you take the diameter of the before and the after, you got 0.48 versus 0.91. So almost double the hair thickness. This is an interesting photo, and after 13 weeks, see significant improvement in the baldness there. Same thing, more 2s and 1s than the prior at 10 weeks out, this one shows. So this is a slide that's kind of complicated, but if you do 3 treatments with the Laze MD in different areas, it can give you a monthly improvement of 23,000 and an annualized revenue of 279,000. You get significant profits with this Laze MD. Again, this is a great procedure to do on other areas, and that's what this is emphasizing, not just Keralase. The other important factor is there's minimal consumable costs when you use the Laze MD. When you're using the Laze MD in other areas, there's minimal consumable costs. I always ask people, when you're trying to buy a certain device, what's important? And these are what I stress to people when I'm lecturing. It doesn't matter how good the device is. If it's not safe, you shouldn't buy it. So it's like the number 1, 2, and 3 most important part of when I purchase a device is its safety. And this Laze MD is extremely safe. I have seen no complications. I've been using the Laze MD for about 4 or 5 years. So is it efficacious with repeatable results? Yes, this Keralase is extremely efficacious and repeatable, as we showed you. Return on investment, we just tried to show you that. Extremely high return on investment. And it's delegatable. This isn't a very difficult procedure to learn. And according to your state guidelines, a nurse practitioner or sometimes even a nurse can do this very easily. And also, is the device able to be used for multiple different procedures? If there's some device that can only be done for arm sweat, and To me, that's not a very great device because it's only good for one thing. This is great for multiple different things. And that's important because you want to get the most out of your device. Minimal consumer cost, as alluded to before. There is a cost with the care factor, but with the laser itself, there's minimal consumable cost. Now, this is also important. You need to have reliable service. If the laser goes down or you're having problems, you need to have it up and running very quickly. Well, I haven't had any problems with the Laser MD or the Ultra, but if there were, most of the time you can actually just take the handpiece off and get a new one in the mail, but even before you take it off and then send it back, and you're up and running within 24, 48 hours. They have very strong clinical support as well. If you have questions or concerns or protocols, they have a lab in the Boston area that they do these procedures day in and day out, and they're looking at refining the procedures, getting you the best results. And so you can talk to them or you can talk to me, and I can tell you my experience as well. The most important thing is the company going to be there in the future? And Lutronic is already working on their third decade, and I predict that they will be here in the future. They've been a great partner of mine. I have, I think, 6 different devices from Lutronic, and they are all very reliable. So how does the procedure perform? So prior to the procedure, the patient should wash their hair that morning and don't add any hair products. Who should not be treated? Hair and scalp should not have any presence of infection, rash, or any condition that would be considered abnormal. Any prior diagnosis or suspicion of skin cancer on the scalp in or near the treated area is exclusionary. Patients with scarring alopecia, alopecia areata, fibrosing alopecia, lichen planus should be excluded. They have not been tested, and the underlying disease processes which may not be amenable to the treatment. So what you need during the Keralase treatment is Laser MD Ultra, 1 vial of Kerafactor, the Kerafactor funnel applicator, alcohol pads, gloves, 4x4 or other absorbent material, a clean comb with a long handle, and a barbicidal jar filled with barbicidal disinfectant to keep the combs disinfected. So before opening, shake the Kerafactor vial. Look for the arrows stamped in the aluminum seal under the clear plastic cap, as you want to lift where the arrows are, pushing up the lip of the cap in the direction of the arrows. Carefully remove the aluminum seal and attach the applicator to the open vial. Keep in mind that this applicator only comes 1 per box, so don't discard it. Now we're going to go over the procedure. So if you're doing this alcohol wiping, make sure that the alcohol is completely dried before you go on with the laser. I know that it's obvious, but make sure. So these are the settings that we use. We use the static mode, the energy mode, 0.5 second interval ratio, 144 spot per centimeter density, the 5 millijoules, and the large spot. That's the C5 tip, okay? 4 to 5 passes on each part, then create another part and repeat. So sometimes you want to treat areas that are outside the area of hair loss. As long as there's not too much hair there, it's a good idea, because what we're after is an overall scalp health improvement. So the more area that can be treated, the better. So you create a part in the patient's scalp from the crown of the head down to the end of the hairline using that comb. Rub the area you created with a 4x4 dampened with alcohol wipe to sanitize the scalp. Make sure that dries. Then you use the following settings: a static mode, energy mode, 0.5 second interval rate, 144 spot per centimeter density, 5 millijoules, and the C5 tip. 4 to 5 passes in each part, and then we create another part. The goal is scalp preparation for the serum and not collagen changes. The settings are not as aggressive as numbing cream is not necessary. Treat the entirety of the scalp where the care factor is to be applied. So you see it's in repeat mode at 0.5 milliseconds, okay? It's very easy, very tolerable. The patient doesn't feel anything. So each pass is counted as one, there's 4, okay? And she'll show you this in fast motion now, and you part the skin over a little bit and repeat. So you're creating these micro channels with the Laze MD Ultra. This whole procedure with the Laze MD Ultra takes approximately 5 to 6 minutes. There's no bleeding. There's no downtime. I have no restrictions on these patients when I'm complete, except I don't want them to wash off this care factor till the following morning. So place the vial with the attached applicator above the treated area and turn it over. And gently squeeze the applicator, releasing a few drops of the serum on a scalp. So that's important. It just doesn't flow out, but you got to kind of milk it using that applicator. Take care to keep the serum out of the eyes because it does drip a little bit on the side of the head. It can also drip on the clothing. So sometimes putting a little absorbing towel around the head is important. Then you gently massage it into the scalp, adding more serum as needed in order to get an even coating over the entire treated area. Once the application is complete, remove the applicator and clean it with soap and water to be used again. Leave the care factor in the hair until the next morning, and then the patient can wash his hair. It doesn't dry hard, and the patient doesn't feel stinging or burning, and it's very patient friendly. So I tell patients to, they can wear a hat. I discourage them from working out, but they can. The big thing is to keep this on the scalp until the following morning when they can wash their hair. And you can see her squeezing it, and it comes out. It's slightly oily, but it doesn't burn or sting as previously stated. There's a lot in the bottle, so it can treat a very large surface area. I try to use the whole bottle on each patient. So I massage it in. The hair gets a little bit wet, that dries out. I also concentrate on the forehead area right in front of the hairline. So that's an area that recedes and bothers a lot of people. Here she is massaging it into the hair. So wash the hair the night before. It must be clean and free of hair products. You have to remain out of the sun for a week before and after. That's because of the laser. After treatment, you might notice hairs in the telogen phase, the resting phase, can be shed. And that can happen with any laser or microneedling procedure. And so you might get calls about this and tell them that it's normal. And it's just the hairs that were going to fall out are expedited using this procedure. And that's it.
Thank you very much for that informative presentation, Dr. Weiner. We really appreciate your time this evening, and thank all of our participants for joining us. Before we wrap up tonight, we just got a couple of very nice, insightful questions from the audience. I'd like to toss them your way, Dr. Weiner, if you don't mind, and just answer a couple questions from the folks joining us this evening.
Sounds good.
Great. So first off, I know you talked a little bit about your exploration process when you first got into PRP a few years ago, and when you looked at different hair growth options and treatments to add into your menu of services at your office. Can you talk a little bit more about that exploration, what initially intrigued you with the hair growth market as a whole, and then how you sort of honed in on the treatments that you offer now?
Thanks, Dan. So I've been doing PRP injections for hair for approximately 6 years. It was something that was introduced to me at the MCAS meeting, where obviously Europe is usually ahead of us, and that was in Paris. And The market has grown significantly since the introduction about 6 years ago, and I'm getting more and more people asking for hair improvement. The problem is that PRP that most people are doing is very low density. I always thought that high density PRP was a significant advantage over the low density. What I mean by that is the concentration of the PRP relative to the regular blood count or platelet counts in the blood. So I always sought to get approximately 5 to 6x PRP versus normal blood. But again, most people are using the low density. In any event, going beyond 6x in some studies has been shown to be detrimental, and that's because there's some growth factors within the PRP that actually are negative growth factors for hair growth. So you're limited on how dense you can get with that PRP. The other thing with PRP is that it's variable between patients, and some have good PRP and some have less good PRP, and that has to do with the quality of their platelets. And recently, actually, a study shows that the quality of platelets in PRP is significantly affected by non-steroidal anti-inflammatories, specifically aspirin, but it opens the case up for all non-steroidal anti-inflammatories. And it showed that the degranulation of the platelets was significantly impaired in people that are taking these. So the results are going to be highly variable, particularly in patients that took these non-steroidal anti-inflammatories. The other negative factor with PRP is that it hurts. And sometimes you actually have to use citrate when you mix up your PRP because that prevents clotting. And that is very acidic. And so not only does the PRP hurt, but the injections hurt. So you have to often do something called a ring block. And a ring block is anesthetizing a ring around the area that you want to inject with lidocaine. And so that takes multiple injections. And then even after doing that, the patient still can feel some of the injections. So after doing all that, which sometimes takes 10 minutes or so, maybe even up to 15, and spinning down the platelets in my high density PRP system takes, with the new system, it takes a couple minutes, but with my old system, it took over 15 minutes. And then there's the blood draw as well that takes time. So then after approximately 20 to 30 minutes in the office, you get started with injections. And again, sometimes the injections are still painful. And so I'd use Pronox, which is nitrous oxide, and that seems to get most people over the hump of the injections. So from start to finish, it sometimes takes 30 to 45 minutes with the patient entering the door and leaving with PRP. And again, I'm only getting approximately maximum 6x PRP in the best case scenario. So then along came a product that was off the shelf called Kerafactor, and then when you combine it with the LazeMD Keralase, that was music to my ear. It had growth factors concentrations that were upwards of 1,000 times what PRP was. And you didn't have to spend the time drawing the blood, which sometimes they're hard sticking. You have to stick them a couple times. And it didn't take the time to spin it down or numb up the patient. So you can go directly to the LazeMD, punch the microscopic holes in the scalp, put on the Kerafactor onto the scalp, and they're in and out of the office in 10 minutes with a better treatment than I was getting with PRP that took 45 minutes. And again, there was a consumable cost as well with the PRP systems that I used. They were upwards of $250 to $275. So even though you think that you're using your own blood, that it's cheap, no, because the system has this consumable cost. So overall, actually, the Keralase was faster, 10 minutes, painless, or maybe a 1 or a 2 out of 10, and less expensive. So it made total sense to switch over to the Keralase. So that's my choice. So after doing it for as many years as I've done, 5, 6, 7 years, I switched over in a heartbeat to Keralase, and I haven't looked back.
Well, thank you, Dr. Weiner. That was a very succinct, easy to understand explanation. We certainly get that question a lot at Lutronic about the differences between PRP and the Keralase procedure, and that was just beautifully explained. So thank you for that. And I guess this sort of ties into the next question that's come through. People are asking a little bit about that term biomimetic growth factor. So it sounds like, in a way, it's a way that it's sort of replacing PRP and doing something in a new, better way, maybe building a better mousetrap, if you will. Can you talk a little bit about what a biomimetic growth factor is, and is it the same thing as a synthetic growth factor?
Right. So what we're doing is we're creating a growth factor that is made outside of the human body. So it has no genetic cross-contamination potential issues. But in all the evaluation of these products, they act exactly like the ones that are in the PRP. So there's no difference in what their outcomes are, but they're done synthetically, and we can produce them in much higher quantities outside the body than within. So there's no blood type issues. It's not like drawing blood from one person and injecting into another. There's no risk of infection. It's just all the positives and gets rid of the negatives. The other thing that you probably are going to ask, and I'll get to it, is that these growth factors, these biomimetic growth factors, are wrapped in something called nanoliposome technology. So what that is, it allows for better penetration of these growth factors than if you just put the growth factors alone on the hair. So studies have shown that if you just put the growth factors on the hair, you have an absorption, but you significantly improve that absorption when you do these nanoliposome coatings. They seem to go down the pores, the hair follicles much better to get to the area where you need it most. So the biomimetic growth factors, as well as the nanoliposome technology, make this a very attractive technology for me.
Oh, that's outstanding. Thank you for that explanation. So I guess when a patient presents in your office, how do you decide if Keralase is the right treatment for them?
It's pretty easy. So usually you look at risk and downtime and pain. And none of those are really an issue with Keralase. So the big question is do you want to have improvements in your hair? And I would say that most people that are in their late 40s or older would say yes. So we can help almost everyone with their hair growth. So who are the people we can help? People we can help are the very scarred patients from scarring alopecia. They're not going to benefit and they need hair transplants, but even those patients aren't going to have the best results because scarring has decreased vascularity and the take of hair transplant is less. The other ones that aren't going to benefit are the ones that actually you can't see any hair. There's no peach fuzz. It's shiny ball, cue ball type of hair, scalp. You need to have hair to improve with Keralase. So what Keralase will do is it will improve the diameter of the hairs present, as well as the number of hairs present. So sometimes if you can't see the hair, sometimes there is the ability to bring out the hair from below by stimulating the hair stem cells with this Keralase. But if it's a really shiny bald head, I wouldn't expect much improvement. Although we are testing someone who's close to that, my father-in-law, and I'll show results down the road. So those are the patients. So almost everyone is a candidate, and you just got to temper your expectations for the ones that are really smooth, shiny, without visible hairs.
Well, that would be pretty exciting if you found some nice results on someone with almost no hair already.
Yeah.
That'll be really interesting to see those results. Well, and that's a great segue once again, Dr. Weiner, because my next question was going to be about setting patient expectations, which you just described that perfectly. I guess more specifically then, if a patient is coming in and you do sit down with them and through the consultation process decide that Keralase is the optimal treatment for them, what can they expect as far as a treatment protocol is concerned and a timeline, number of treatments, things like that?
So through their research, the company has set 6 treatments is the optimal number. And if possible, they like to do them every 2 weeks. That's not always possible. And I'm not sure if you spread them out to once a month that their results will be affected, but I'm just telling you the company guidelines are every 2 weeks. In their preliminary studies, what has been shown is that the hair diameter, so what happens when you start to age in the scalp with the hair? The number of hairs obviously decrease, but also the diameter of the hairs gets smaller. They call it miniaturization. And all that is a phenomenon related to decreased perfusion, decreased vascularity of the scalp. So all this work is trying to improve the vascularity as well. And in fact, LaserMD alone can improve hair by improving vascularity. So basically, we tell people you're going to get, if you really looked at the hairs, between 50 and 100% improvement in the diameter. And you could get up to 50% improvement in the density as well. So sometimes it's very difficult for a patient to appreciate until you get that, because let's take the opposite. I heard a study that said people that get laser hair removal don't recognize a change until it's 50% gone. So it's very difficult for the individual to really appreciate changes until you've really gone out several months. But in my experience, after the 3rd treatment, so doing the protocol, when they come in for the 4th treatment, patients do notice a difference. So, you know, it's not going to be instant, so don't expect patients to notice changes immediately. They're going to continue to improve months after the treatment as well.
So is there a photography aspect to that with your follow-up treatments, so that just to kind of help remind patients of where they were, you know, baseline versus when they continue to come in and visit?
Yeah, photographs are done at every visit before they get treated. And because right now digital photography is so cheap, why not? And you have to get obviously meaningful photographs that are in the same light as well as the same views. There's a new system from Canfield called Hair Matrix that I've just purchased, and I will start to use in my follow-up patients, that actually quantifies the number of hairs and looks at the density and so forth. And so that will be an exciting new aspect in our clinic, and hopefully we'll have some good research reports from that.
Yeah, that's outstanding, Dr. Weiner. I'd love to hear more on that. I think that kind of technology has certainly been improving at a rapid pace, but I think it'd be really nice to see something that's so quantifiable, especially in an area like this where, like you said, it's very hard for the patient to really perceive improvement when they see themselves every day in the mirror. So I guess just to wrap up, I've gotten a few questions popping in here about the device itself. I know you're a big fan of the thulium wavelength. You've used several devices, including, of course, the LaserMD Pro, and now you have the new Ultra from Lutronic, which we're very excited about, and we've gotten some really wonderful reviews. Keralase is a very important part of that Ultra package, and it's a super exciting breakthrough treatment, as you've talked about the last hour or so, which we very much appreciate. But do you mind just touching quickly upon some of the other applications of the Ultra and of the thulium wavelength, and where you really like to incorporate it into your practice?
Yeah, thanks, Dan. I've been using thulium wavelength since 2008, I believe. And it's a real workhorse wavelength. It's extremely safe, and it's extremely reliable. It's safe for all skin types, which is a great aspect too. The downtime is minimal. So you have between 24 and 48 hours of some mild redness, sometimes at the most, sometimes less. It's a great procedure to use for pigmentation because it's so superficial. It doesn't hurt that much. So I personally have had the LaserMD Ultra twice without any topicals. So that's another big factor. With the other 1927 that I used in 2008, we have to have the patient sit in our office an hour or more to numb them up for the procedure. And you don't have to do that with the LaserMD Ultra. The procedure itself takes approximately 10, 12 minutes to perform, and it could be performed on any parts of the body: arms, legs, abdomen, face, neck, chest. Those are all common areas. The beauty of this device versus the other is that the lack of high consumable costs. So it became unaffordable if you wanted to do large surface areas with the other 1927. I'm talking about another company's 1927, because people wouldn't be able to pay the amount that it costs for even just a consumable, let alone your time. So that's another huge factor. I like to use the 1927 spot treatment as well. So they have a very powerful new static spot treatment with this LaserMD Ultra that is 28% per spot if you turn up the settings all the way. So when I'm doing a face and it has some prominent spots, I will hit them first with the static, and then I'll do the rolling technique. And so I'm more aggressive with those spots. Another particularly good aspect of 1927 is that it doesn't have a chromophore that is pigmented. Its chromophore is water. So a lot of lasers use pigment as their chromophore, melanin, for example. With the pigment that is very light, that is very close to the pigment of the skin color, it's very difficult to clear those with lasers that are attracted to melanin. So using a laser that's attracted to the water, you get a much better clearance. The other thing that I've had much success with the 1927 is melasma. Obviously, melasma is a very, very difficult problem, and it's not what I go to at first. I try topicals, retin-A, hydroquinones, other skin lighteners, sunscreens, sometimes HelioCare, and cysteamine as well, Cispira they now call it. So I use all these other topicals. If I'm not getting anywhere and the patient is disgruntled with their melasma, I do offer them the 1927 laser. And it seems to be really good at getting rid of the melasma without stimulating further pigmentation, which is the risk with any lasers using melasma. And in particular, there is some evidence to suggest that possibly using the stamping technique for melasma might be a better way to go as well, because it doesn't go as deep. So you're not going to stimulate the pigmentation as much. So that's something that we're looking into as well, using the stamping process. So the stamping technique, which I've been experimenting with, can get very aggressive. So if you use a stamping twice on the face, you're getting practically 60% coverage in 2 passes. And then to blend in the stamping technique, I do use the rolling technique, 1 to 2 passes to blend it in. And that seems to be a very aggressive treatment, no topical needed. Again, takes 10 to 15 minutes to do, but it's very aggressive. Now, when I talk about aggressiveness, you got to boil it down to the power. So the LaserMD Ultra is now 20 watts, and that's higher than any other thulium laser on the market. My predecessor prior to the LaserMD Pro was was another brand, and that was 12 watts. So it's significantly more, 8 watts more, 60 some odd percent more than that. So it's a highest wattage thulium laser on the market, very versatile, great for pigmentation. I mean, that's my go-to for pigmentation. People love it because there's very little downtime, very predictable, and the consumable costs are low. So it's a great laser to have in your armamentarium for other stuff other than the Keralase, because in my opinion, you don't buy a particular device for one thing, because if you just use it for one thing, it's going to be hard to make money. But if you have a lot of different things with one device, then it's going to make you money. Like the Genius, the Genius can do a whole bunch of different things, including hyperhidrosis, skin tightening, acne scarring, and so forth. And that's why it's such a good device as well.
Well, that's great, Dr. Weiner. Thank you very much for that very detailed explanation. Certainly, I'm biased, but I couldn't agree more regarding the virtues of the Ultra and the thulium wavelength as a whole. And I can attest to the pretty awesome before and afters that you showed me from your patients. I think what you're doing, especially with that larger C5 tip that you referred to, the bigger spot for the stamping, it's so effective on the surface pigment and whatnot. And I think a big part of it is the fact that it doesn't go too deep and doesn't overstimulate the deeper melanocytes and cause things like flaring and PIH and issues in darker skin types especially. So
right. Well,
thank you very much for sharing that. We'll certainly dive deeper into that in the next session.
Sounds good. Two points. One is that I did mention the Genius, and I have written a couple papers about the combination of using the Genius with the 1927 laser, and total skin solution type of protocols, and it's extremely safe and adds approximately 5 to 7 minutes to anyone's Genius procedure, and just gives them a much better outcome. Because what you're doing is you're treating the skin surface as well as the mid and deeper dermis with the Genius. And it has very low adverse events as well. The LaserMD Ultra is a very safe modality.
Absolutely, sir. I could not agree more. Well, unfortunately, Dr. Weiner, we've definitely enjoyed the time, but we are running out of time. So it's time to say goodnight, but I thank you, as always, for your continued support and loyalty towards Lutronic. We can't appreciate you more. And I want to thank everyone else for joining this evening. You'll see on your screen, there's different ways to contact us. If you don't already have someone's number in your phone, you'll see their website, an email address you can use to get in touch with us here at Lutronic, as well as the main phone line. And always, please follow us on our various social media channels. We've been very active on those, particularly in the last few months. So a lot of great content coming out really on a daily basis there. So please continue to keep in touch with us. We love to see your wonderful results in your office. So please continue to send those in, as well as your happy patient stories. Those are always great to share, especially these days. So thank you all. Thank you again to Dr. Weiner, and appreciate everyone joining. Have a great night. We'll talk to you soon. Bye-bye.
Bye-bye.